mean, there are many catastrophic injuries, but among the most catastrophic injuries and among some of the saddest injuries are traumatic brain injuries and neurologic injuries. And I was very interested in how we could try to get those better. The biggest changes that have occurred in the field now is that MRI scanning was very new when I first started. In fact, it wasn't generally available when I first started training. And now it's very easily available, and it gives us pictures of the nervous system that really were not available back in the 1980s when I was first training. I think the most satisfying part is seeing that we can help families and people who've had a catastrophic injury, and we can help them come back and still have a satisfying life. And even in some of the most catastrophic injuries where prognosis seems to be not good or poor, there's still hope, because there's always a chance and a possibility that things are going to go better than we expect. Much more so, I think, in head injury and some other illnesses. We have a team that's been together a long time, and they know what to do, and we try to each empower each other to go do what we know how to do. We don't try to interfere in each other's work. We collaborate, we use each other's strengths, we know each other's weaknesses also, and the idea is to let everybody be autonomous and get the most out of everything for their patients. We don't put any ceiling on where somebody's going to get to. Sometimes, even if it doesn't happen at Helen Hayes, we're laying the foundation for the future. We've had people who've come in with post-traumatic coma, haven't improved that much when they were at Helen Hayes, but we were able to lay a foundation, get them medically stable, make sure they didn't develop contractures or other kinds of complications from their injury. And then maybe a year later, 2 years later, they come back and they see us, and they may not even remember being at Helen Hayes, but they're much improved. And I think the important part is that we were able to lay a foundation so they and their families didn't need to give up on them. Over time, they can make gains, and that it might not happen in a day or a week. Sometimes tell them it's analogous to hair growing. You don't see any difference from day to day, but you look back in 6 months and there's a big change.